Buenos dias, Zamboanga. Welcome sa Katiyan na Zamboanga Public Briefing kung saan pag-uusapan natin muli ang pinaka-latest update patungkol sa COVID-19. We are live via PIA Western Mindanao Facebook page and via cable televisions at eMedia and MCTV. Ating kumustahin muli ang ating sitwasyon ng COVID-19 dito sa buong rehiyon. Kasama po natin muli ang Department of Health Region 9. We have Dr. Jemuel Cristobal. Welcome po, Doc.
Thank you very much, Myra, and good morning to you and to everybody watching at home. So let's proceed with the national data as of November 8th. We have 32,077 active cases and 2,728,696 recoveries and 44,521 deaths with a total case count of 2,805,294. For the Region 9, as of November 7, 4,672 active cases, 41,116 recoveries, and 2,048 deaths, with a total case count of 47,841. For the breakdown, let's zero in at Zamboanga City, with active cases as of November 7 at 1,523 and recoveries at 18,700 plus, 925 deaths, and the total case count of 21,244. As of specimen processing statistics for November 7, total specimens processed and forwarded for the day is at 617. For the number of RT-PCRs conducted, as of November 7, as mentioned, the total of 617. Out of that number, positive results were yielded at 68 and negative results at 549 with a positivity rating of 11.02. For the regional PTMF bed capacity and utilization, so for the whole region, we are at 11.25% utilization rate. The highest peg is at Zamboanga City at 58.40% and Isabela. The rest are at 8%, 2%, and for Del Norte, Del Sur, and Sibugay respectively. For the equipment utilization for the whole region, also for November 7, all are at low risk in terms of isolation beds, ward beds, and mechanical ventilators utilized, which is a good sign. And ICU bed utilization is at moderate risk. For the regional health capacity utilization rates as of November 7 for total bed utilization and mechanical ventilators. So for all the provinces and cities under Region 9, all are now under the low risk levels. For the regional healthcare utilization rate for Region 9 as of November 7, these figures are a combination of COVID ward beds, isolation, and ICU beds, mechanical ventilators. So for the region and a breakdown of each, all of the provinces and cities are at low risk level. For the alert level classification for the entire Region 9, we are at alert level number 2, and all of the provinces and cities are at alert level number 2 except Zamboanga City and Isabela at alert level number 3 respectively. For the vaccination coverage as of November 3, we have already targeted eligible population of 1,910,634. Those that have received the first dose, 679,003, which is 35.5% of that population, and those that have completed the second dose at 611,470, which is 32% of that population. for the total vaccines received by the region on November 10, overall total vaccines that we have received, 2,416,967 doses. And that concludes the situationer for Region 9, Ma'am Myra. Thank you very much.
Maraming salamat po, Doc, sa inyong update, sa ating regional and national update rin po. And of course, sa ating mga vaccination po, no? Doc, do we have, ano po ba, yung update po patungkol sa ating rollout of pediatric vaccination naman dito sa region? I know sinimulan na natin ito this week. So kung meron po tayong data, kung ilan na po ba yung ating nababakunahan?
Yes, so for the pediatric age group, ages 12 to 17, we started for the A3 under PEDIA, under that age group last October 29. And then for the rest of the PEDIA under 12 to 17 at November 3. So as of the A3 PEDIA population that has been vaccinated to date, at 3,459. And then the rest of the PEDIA population, eligible population, 2,492. So that's 5,000, almost 6,000.
Okay, so medyo marami-rami na rin po tayong nabakunahan for our pediatric po, no? Doc, so far, okay naman po, wala naman tayong mga adverse effects reported for the pediatric vaccination?
So far, I asked the data managers, and I think so far 10, but only mild adverse events following immunization. Yes.
Thank you, Doc. Doc, is it already safe po ba following po that yung ating vaccination for the pediatric? Is it already safe na ba para sa ating mga students or the children to start face-to-face classes po?
Right. Like for example, in Manila, we hear rumors in terms of reopening, but of the universities, so the college universities, for face-to-face. We heard that on the news a few weeks or months ago, and then but this is for a population that has been vaccinated. And then we also heard rumors with the DepEd of planning reopening, but in the far-flung barangays. So the quick answer there is that I guess until we reach the herd immunity or being able to vaccinate 70% of the population, that would be safe to decide whether or not to reopen. So as of now, I think that it's best to just really keep our guard up.
Okay. Thank you po, Doc. Speaking of our vaccination program, Doc, which priority groups po ba natin ngayon ay ang may pinakakaunting percentage or for the vaccination coverage natin? And what do you think is the reason for this, Doc?
Yeah, so initially, when we started the vaccination, our number one problem was the number of vaccines or the supplies. And now we see the number of doses that we received, at 2 million plus. So the numbers is not the problem, but the age group or the priority age, the priority group that we are having the most problem with regards to the vaccination rollout is the A5, the population in poverty. So that is why the Department of Health launched another strategy to really address these in the areas with very low vaccination statistics. As we speak, they are already deployed in the different in the different municipalities to really find out why this is the reason. Personally, I have some very close friends who have been positive, but their houses are located in the slums, and all of them, if you ask them, none of them want to be vaccinated. So it's I guess an issue of the education. Educating them of COVID-19 and the vaccination. Yes.
Thank you, Doc. Doc, with the trend of cases po ngayon, nakikita natin no decreasing yung ating mga cases in the region. Are we going to expect po ba a better Christmas celebration or holiday season this year?
So we hope, no? We continue to hope and pray. So if you look at the statistics, no, they're very dramatic decrease. Initially, just a week ago or 2 weeks ago, we were at moderate, high risk levels, no, and then now we're dropping down. So indeed, the cases are dropping for the whole of the region, but I recently talked to people from the Research Institute of Tropical Medicine from Manila, and they still said that we're still concerned for Zamboanga City. If you look at the statistics, the daily reported cases are indeed going down. Like, for example, I think November 8th, the new cases for Zamboanga City, according to the task force of Zamboanga, is only at 30. So that's good, no? A decrease in daily cases. But the active cases are still at 1,300 plus. So the daily cases are decreasing, but the active cases are still quite high. So the quick answer there is that let's continue to pray and let's not put our guards down.
Thank you very much, Doc. Doc, any more message po, no? Probably we can encourage more residents po na makapagbakuna na so that we can really expect po, no, a happy, a better celebration po or holiday season this year. So what is your message po, Doc?
Yes. So in closing, once again, thank you, Ma'am Myra, and to our viewers. So I'd like to conclude by just reminding everybody to still adhere to the wearing of face masks and face shields, especially in public, the social distancing, proper ventilation, especially in closed areas, and frequent hand washing, hand sanitizing, and of course I did not follow anymore the proper sequencing, and of course the vaccination, very important, the vaccination rollout until we get to the target population, target statistic of at least 70% of the entire population vaccinated. That's the time that it would be safe to say that things would probably get better. Until then, let's keep praying and let's keep our guards up. Thank you very much.
Okay. Once again, maraming salamat. Thank you, Dr. Gemel Cristobal from Department of Health, Region 9. Thank you, Doc, sa update. And of course, sa ating messages po natin sa ating mga residents. Maraming salamat pong muli sa Department of Health and thank you sa lahat po ng mga nanood ngayon sa ating programa, sa ating COVID-19 update. Magkita-kita tayo sa susunod pa pong linggo para po sa ating COVID-19 update dito sa Kapihan na Zamboanga. Ito si Myra Espinosa. Maraming salamat. Mag-ingat po tayong lahat. Tiyan Fidao Esteves.